This is Volusia Today, a public information radio program brought to you by the County of Volusia.
Good morning, everyone, and welcome to Volusia Today. I'm Clayton Jackson with the county's Community Information Division. Today, I am joined by my co-host, Pat Kewen. Thank you so much for tuning in this morning. Volusia Today is made possible by our sponsors, the Daytona Beach International Airport, the Ocean Center, Volusia Recycles, and Votran Public Transportation. Good morning, Pat. How are things your way?
I'm doing great, Clay. Thanks. And I'm real happy to see that we're almost halfway through hurricane season now. It goes until November 1st, and unfortunately, they do say that the coming months will be the most active ones. And we all remember what happened last year in September and November when we had our unwelcome visits from Ian and Nicole. So it's good to get yourselves prepared and ready for the next hurricane.
That's right. And just to make sure that if you have not done so already, to please download the Volusia County Emergency Management app. There are a lot of wonderful resources found in that app that will be beneficial to everyone. Just to let our listeners know that the Volusia County Council will be hosting two specially called meetings in the month of August. The first one will be held on August 23rd at 5:30 p.m. and the second will be held on August 30th at 4 p.m. And both of those meetings will be held at the Thomas C. Kelly Administration Center in DeLand. And for anybody who'd like to attend or find more information, all that is available at volusia.org. Also, the Transform 386 public hearing for the draft action plan that we've been talking about a couple of times on the radio, it will actually be held on August 24th at 5:30 p.m., also at the Thomas C. Kelly Administration Center. If you have not done so already, please go to transform386.org and you can review the action plan and provide your comments on that. So please, 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 if you have not done that, please do that the way, because your feedback is critical to the resiliency efforts in Volusia County. So today we are joined by a couple of guests from the Volusia County Health Department. We have Stephen Civitelli, the director, and Wendi Jackson, the public information specialist. How are you all doing today?
Doing well, Clayton. Good to see you.
Wonderful, wonderful. So now that school's back in session, and my 8-year-old is pretty excited about that, and I think my wife may be more excited than he is, actually. But with that, we have the understanding that the health department has an initiative to do some things for school-age children. You want to elaborate a little bit on that?
Sure. So since 2011, we've been providing a sealant program to all schools. We have a dental team that goes into every elementary school here in Volusia County, and they check the kids' teeth and provide some basic cleaning tips, techniques, and then they seal their teeth. I don't know if you guys know what sealants are, but they take a thin layer of plastic and they paint it on the backs of the kids' teeth, like to cover up the grooves, and it prevents bacteria from getting into the teeth, and obviously it helps with cavities, so that's the whole reason for doing it. But it's a free program. It's offered to every kid. There's usually a we're coming to your school kind of thing, and they give them a form, and they want that form to go home to their parents and come back signed. So if they bring that form back, anybody's eligible here in the county.
That's a great service. Are there particular ages that you target for this?
It's all of elementary school kids.
So for this coming last school year, we actually attended 43 schools.
Oh, wow.
Which is a really amazing work by the clinical team and the dental team. So we're really pleased with their efforts this past year.
So it's literally simple as the school sends a permission form essentially in the kid's backpack. They take it home. The parent or guardian, they sign it, return it. Then your team shows up and they do the thing, and that's it.
Yeah, the dental sealant van shows up. We set up at the school at a designated location by the school, and then we see as many students as needed.
And all the kids get a goodie bag and free toothbrush, so it's kind of fun.
Hey, that's always a nice surprise for them. And sometimes these programs are associated with eligibility standards such as income, anything like that. Is there any other requirements?
Nope, no other requirement.
Nope, no requirements.
Hey, parents, so you save yourself some money and save yourself some time, because I know what it's like taking children to the dentist. That's a couple hours out of your day right there.
Now, what about adults? Do you offer dental services for adults?
Yes, Pat. Any adult that has Medicare can see us for emergency services if they don't have a dentist and something comes up. They're not covered by anything, so they can come in and get emergency services. But if you're a West Volusia Hospital Authority card holder, you can get any of our services, which means a cleaning, a filling, an extraction, and emergency services. All that's available to the West Volusia Hospital Authority patients, and they can go to either Orange City or Daytona, whichever's more convenient for them.
All right, and just to clarify for our listeners out there, sometimes people confuse Medicare, Medicaid. So just clarify that.
It's any form of Medicaid.
Medicaid,
Yes.
Medicaid. Okay, just want to make sure people are onto that. So what type of dental services do y'all provide to the eligible clients who are able to go there?
Cleanings, fluoride treatment, examinations, extractions, anything that's emergency related, anything you would get at a regular dentist.
Okay.
It's fairly extensive, and we're currently looking at renovating our dental areas as well as our clinical areas, so it's something we're excited about for 2024.
No.
Okay, and how do people get an appointment?
There's a number on our website. It's 386-274-0896, and we're floridahealth.gov if you need to check us out on our website.
Oh, good. And I think you said they can either go to the health department in Daytona Beach or Orange City?
Correct. Yep.
Okay.
Great. So we did kind of touch on hurricanes a bit earlier. I know I hate saying that word, but gotta let people know what we're talking about. And in the event that there is a hurricane or other type of disaster, shelters open up, and there are general population shelters, and there are also special needs shelters. And for the public out there, they may not know that actually these special needs shelters are open and operated through the health department. Am I correct in that?
Absolutely correct.
Great.
Yeah, so the special needs shelters are designated to the health department by statute. There's a specific set of guidelines that we follow that actually will determine who could actually enter those shelters. It's something that over the years has evolved, but for the time being, I think what is the most relevant are those that are on oxygen, electric dependent. Obviously, in a hurricane, we have some concerns there. We actually provide the oxygen. We always ask folks to obviously have a plan, and I know we work very closely with emergency management here in the county. The way I always refer to is take care of your 3 Ps, your pills, your people, and your pets.
Ooh, I like that.
I like that.
We're going to make sure Jim Judge can get that.
I know,
That's a good Jim Judge
It's
right
a
there.
tough one to beat Jim with the lifeboat, but
Yeah, he's got a trademark on that.
he's got a trademark on that. But we talk about the 3 Ps. So when you have a plan for all 3, that definitely helps us because we do not have the capability at this time for pharmaceutical agency to actually enter the shelter, but that's something we're actually looking at, is expanding our reach there. But really, from our standpoint, we recognize folks are stressed, they're outside of their normal environment, so we try and make them as comfortable as possible in these events. Typically, it's either a school designated by the county. However, we're looking at other facilities as well throughout the county. We typically would do multiples on either east or west side, depending on how the event looked. So it's fairly extensive, but we have a great team. Department of Health staff with our clinical folks really do a great job with staffing and actually manning the shelter 24/7 for as long as needed.
Nice. And so far as if somebody did have a special need and they did need to seek refuge at a shelter, A, what should they bring? And B, who should they bring?
They're going to bring whatever they need to be as comfortable as possible in the shelter. And that would include their medications, because like Steve said, we can't be a pharmacy. But also, if they're bringing a pet, they need whatever that pet needs as well. And they're encouraged to bring a caregiver if they have a caregiver, but we want to limit their regular family members. They can go to a regular shelter and not necessarily take up needed space in the special needs shelter.
Okay, now I think I heard you say that the special needs shelters are targeted specifically toward people who need oxygen or who have an impairment with, or who are impaired visually or with hearing. Is that right?
A cognitive impairment, any kind of vision or hearing impairment, and the external oxygen.
Okay, got it. And do they need to pre-register or can they just show up?
We would love that they pre-register. That's pretty important because if they do that, we're going to call them in advance and make sure that they have a plan in place, that we have the right contact information for them, who are they been anticipating bringing. So yeah, pre-registering is great, and you can do that online as well on the county website, actually.
We even partner with Votran to work out the transportation piece, whether it's coming or going when the shelter opens and when it closes. So it's a really nice opportunity for collaboration within the county and making sure that the citizens are cared for.
Nice. So, how are you guys liking the temperatures outside the last few weeks? I have to ask that.
I don't go outside. He's from Connecticut.
I'm from up north, so it's an adjustment.
Roasting.
But, it's been good. But there are some concerns, obviously, from the health department perspective that we have with extreme heat. And I know we've put out some press releases, some information regarding how to stay safe during those warm temperatures. So I know Wendy could probably elaborate more on that.
Just if you have to be outside, that you're well hydrated and you have water and an electrolyte type drink with you at all times. And if you feel like you're not doing well, to go inside and get cooled off. And I know the county's provided some, and the cities have provided some locations where you can do that. But it's just real important that you hydrate yourself. And if you know someone that's like not feeling well working with you outside, that you get them into a cool location as soon as possible.
That's right. These heat-related illnesses can be deadly.
Yes.
I understand that we have heat exhaustion and heat stroke. Can you tell us the difference?
So,
No,
go ahead.
please, you were starting, so I was
just going to say that if it's all about your core temperature and if you're nauseous or not nauseous, but also you can check their pulse rate. And if their pulse rate is high, that's the stroke potential. And if it's normal or low even, then that's not the stroke that you have to worry about.
And we monitor our local systems to see if there's an increase in heat stroke or heat exhaustion. Obviously, I think in the last few weeks we have seen an uptick in that, those types of cases. However, we're hoping that it looked like this weekend we were going to start to see some relief. But again, it is only mid-August, so I guess we'll see what comes ahead of us.
And, just for our listeners out there, as we did mention, that there are a number of cooling stations across the county right now. And I think, Pat, you want to touch a little bit about those? I know you've issued a few news releases on those.
Yeah, that's right. Yeah, people can stop by any one of our 14 library branches. They're all across the county. And you can spend the day there if you want to. Read a book and grab a bottle of water and enjoy the cool air. And a few other locations have opened. Two are in Ponce Inlet. The Bridge Shelter over in DeLand is offering a cooling station primarily for homeless people, but anybody can stop by. And the Salvation Army in Daytona Beach is going to be opening up on Monday.
All right, awesome. All right, so with that, we're going to take our first commercial break. Don't go anywhere, and we'll be right back with Volusia Today.
Subscribe to the Volusia County YouTube channel.
And hit the bell icon to know what's happening in your hometown.
There are so many great places to explore.
And things to learn.
With over 1,000 videos available right now, the channel offers something for everyone.
Let's go!
Did you know we have countless features showcasing history, nature, wildlife, and recreation? Subscribe and hit the bell icon.
Or that we live stream important county meetings and workshops where leaders make decisions that can impact our everyday lives. Did you subscribe yet?
Or that we record our weekly radio show, Volusia Today, where we interview staff from the different divisions and departments across our great county, and they discuss the nitty-gritty of their field and expertise.
Go ahead, subscribe.
But that's not it. There's more. Subscribe and hit the bell icon and fully explore.
Score!
We're back. I'm Pat Kewen along with Clayton Jackson, and you're listening to Volusia Today. This is a public information program brought to you by the County of Volusia. So we're here with Stephen Civitelli and Wendi Jackson from the Volusia County Health Department. And I'm hoping we can talk about the opioid epidemic next. It's been affecting families all across the nation and unfortunately right here in Volusia County. Can you tell us what the health department is doing to help out with this.
Yeah, there's been a lot of activity in this area for us at this time, but I could speak specifically to what's known as the CORE program. Last year, we were fortunate enough to obtain a pilot program that came from the Department of Health to enhance the quality of care for Volusia County residents that are suffering with substance abuse. So essentially what we did was we partnered with the Halifax Health, Daytona Beach Fire Department, SMA, and the VRA, and really tried to create a network or a continuum of care from the time when a person or an individual overdoses to when they're actually seen afterwards, and to try and prevent that cycle of addiction. Because we find that, in the moment you could treat someone with the Narcan and try and stabilize them in the moment, but it's really the aftercare that prevents that from reoccurring. And so that's where the pilot program really started, really July of 22. And actually the pilot program is ending for us in September, but actually it's going to be carried forward in the coming years, is my understanding with this program. So we're really excited about the results we've seen from that. Part of the program is Halifax Health has a nurse navigator in their ER that actually responds specifically to these events, makes that warm handoff for SMA afterwards to try and make sure that network of care is there to stabilize a person and make sure that they have that aftercare. And then the community paramedicine part, which is really amazing, working with Daytona Beach Fire. We've been able to actually offer paramedicine in the community, and it's something that's worked very well thus far, and we're excited to see how we could expand that beyond the borders of Daytona Beach, which was the pilot program, and really look at doing an east and west side collaborative moving forward.
That's great. Now, do you recommend that parents pick up a kit and have them at hand just in case their child succumbs?
Yes, and in any case, or anyone you know and love, sometimes there's situations that are unforeseen, and so we do have the Narcan available at the health department free of charge. Any of our locations in Orange City, New Smyrna, or Holson back here in Daytona, you could actually pop into the clinic and request some kits, and we could provide those free of charge. So it's a way to get some out in the community and hopefully save someone's life if necessary.
Now, if people pick up a Narcan kit, can they keep it in their hot car?
They should be at room temperature, Pat. Obviously, nothing survives in a Florida car right now, but we encourage people to put it on themselves, like in their purse or in their backpack, because you're never going to know, when you see somebody. So you want it to be on your person for the sake of you have it with you, but also that you avoid the temperatures of the car.
Oh, good. And how do you go about administering it?
So everybody thinks it's complicated or it's an injection or something silly. But if you can use Flonase, like the allergy spray up your nose, you can use Narcan. So you're just gonna, if you find somebody unresponsive, you're gonna shoot this. It's in a little vial and it comes just like the Flonase. You're gonna squeeze it and it goes right up their nostril. And if you wait a couple minutes and there's still no response from them, then you're gonna administer it on the second side, and you're not going to do anything to harm them with it if it's not an overdose situation. There's no negative effects from getting Narcan if you didn't need it.
Oh, well, that's great. So when they do go to pick up some of the Narcan kits at your all's locations, would staff be so courteous to give a demonstration if they ask? Sure.
Our clinic staff are very well versed in it, but there's really great instructions in the box if you forget what you're supposed to do in the moment anyways.
All right. And just reiterate, want to make sure our listeners understand this, that anybody in Volusia County, they can go to any of the health department locations and they can request Narcan kits and they will get them free of charge.
Correct.
I just had to throw that out there one more time just so people clearly understand that.
Yeah, I think it's a good service that we offer at this time, and it's something that has been the response has been great from the community in that they've come to pick up kits.
Great. And let's go on to something else real quick. So a close cousin of the SNAP program, which some people still commonly refer to as food stamps, is WIC. Elaborate a little bit on what WIC is. WIC for those out there.
So it's Women, Infant, and Children is what WIC stands for, and it's basically a nutrition assistance program for pregnant moms, and kids up to age 5. So if it's income based, obviously, and if you qualify, we're going to give you a card, or you can use an app on your phone, and every month we're going to load whatever it is you qualify for. If you're pregnant mom, you get, dairy, whole grains, fruits and vegetables. If you're nursing or trying to nurse, you could get formula if you needed to supplement. Also, the kid's going to get the similar kind of stuff, but they load everything onto a car and you take it to a qualifying grocery store, and you can use it to get those items.
And just for our listeners there, to clarify, SNAP, again, formerly known as food stamps, that program is administered by the Florida Department of Children and Families. WIC is administered by the Health Department.
That's correct.
There we go.
That's correct. And right now we're seeing clients in person at our Orange City and Holzenbeck locations here in Daytona. But one thing we're excited about in the future is actually our Keith Street location, which was damaged during Hurricane Ian. When we rebuild it, which we're in process, we were just awarded a contractor recently, that's going to be a home for our WIC clients. And so we're really excited that the clients there will have a brand new renovated facility to receive WIC services in the community.
All right. And if somebody is already receiving SNAP, can they also jump on WIC?
That's correct. SNAP is a monetary, it's not, fruits and vegetables and that kind of thing, whereas ours is specific like food products. But yeah, because SNAP is available even if you're a senior and not necessarily pregnant. So.
All right. I just have to ask this because it is WIC, women,
children.
And children.
So, are men eligible to apply for this program?
As long as you have a child who is under the age of 5 and the birth certificate of that child has the father's name on it, or they can prove that they have legal guardianship of the kid.
All right. Wonderful, wonderful.
Okay. Now, when people think of the health department, we automatically think about the health and wellness of humans. But I think that you're also working in environmental wellness as well. Can you tell us about some of the programs you offer?
Yeah, environmental health's a big part of public health, and I think the relationship between health and your environment is huge. So from the public health perspective, we actually license facilities and inspect. Right here in Volusia County, we actually administer the Clean Water Act within the health department, so some of the drinking water systems that are here, private wells, as well as the on-site septic systems, what we refer to as OSTDS. So when you're looking at those relationships between, the individual and their environment, we want to make sure everyone has clean water. We want to make sure that the wastewater is being disposed of in a proper manner. Making sure that some of the facilities that are being utilized in the county are actually licensed and inspected, that they're safe for use. So again, it's definitely a lot going on there when we're looking at the environment, making sure that we preserve and protect that environment for all.
Right, and the health department, they're always looking to improve the health in the community, and part of that is through their community improvement process. Stephen, will you tell us a little bit about what this process looks like?
Yeah, and I really like this process. So the process is a two-part process. You have the community needs assessment, and then you have the community health improvement plan. So the first, what happens is really you have a community needs assessment. It's unique to each community. All right, it's based in Volusia. It's a grassroots event that where we get feedback from folks in the county, whether it's residents at large, nonprofits, for-profit agencies, government entities. Really a mashup of all types of information about what the community is looking for health and wellness. And then once we kind of get all that information together, we generate what we know as the community health improvement plan. And we really try and take the core issues, distill it down, issues like social and behavioral health, whether it's environmental health issues, access to care, which is a big one for public health. So then we really try to boil that down and really function as a neutral convener in the community to make sure that if we can't offer a service locally at the health department, we could refer out to certain areas, whether it's OB care or whether it's certain dental things, if dental care, if we can't offer for whatever reason, or clinical care. So we try and function almost as a quarterback for the community in some ways. But obviously it gives you some measurables to focus on when you have a community health improvement plan and try and move in the proper direction to see improvement.
Guys, keep up the great work. That is very interesting, and just thank you all for always looking out for the health of our Volusia County residents. We really, really, really appreciate it. All right, so with that, we're going to take our final commercial break, and we'll close out the show when we return. Do not go anywhere.
Subscribe to the Volusia County YouTube channel.
And hit the bell icon to know what's happening in your hometown.
There are so many great places to explore.
And things to learn.
With over 1,000 videos available right now, the channel offers something for everyone.
Let's go!
Did you know we have countless features showcasing history, nature, wildlife, and recreation? Subscribe and hit the bell icon.
Or that we live stream important county meetings and workshops where leaders make decisions that can impact our everyday lives. Did you subscribe yet?
Or that we record our weekly radio show, Volusia Today, where we interview staff from the different divisions and departments across our great county, and they discuss the nitty-gritty of their field and expertise.
Go ahead, subscribe.
But that's not it. There's more. Subscribe and hit the bell icon and fully explore.
Score!
We're back. I'm Clayton Jackson with Volusia Today. So we're wrapping up our discussion with our guests from the health department, Civitelli and Wendi Jackson. So Stephen, real quick, as the health part director, I just have to ask, what made you get into the career of public health, public services, bettering the health of our community?
So it's interesting, Clay. When I got my bachelor's and master's in public health, I really looked at being a servant leader in the community. And one way of really serving the community is to actually improve the health and wellness. And I think that that's something that really drives me. I've always been passionate about health and wellness and environmental health. And I think the mission in and of itself, and you've kind of seen today some of the things that we're doing in the community, and as we continue to expand our reach in the community, I think we're going to have a lot more impact as time goes on. But again, addressing some of the access to care and social and economic barriers are all things that we look at in public health. And it's an exciting time to work at the health department. We have several positions that are open that were available online on People's First. So we have a good work environment. And again, we're really excited about the vision that we have moving forward with trying to improve the health and wellness in the community. And again, not to wrap up with the other 3 Ps, prevent, promote, protect. So we went with your people, pills, and your pets, and now we're going to end with prevent, promote, and protect. So that's what we do.
That's awesome. Real quick, in about 10 seconds, why should somebody come work at the Volusia County Health Department?
You know, the mission is something that we really focus on. And to be able to serve your community, I think is something we really enjoy.
Perfect. So, Wendi, Stephen, thank you all so much for coming on today. Keep up the great work and keeping our citizens safe and healthy. With that, we're going to end today's show. Have a wonderful day, Volusia County.
If you have a comment about Volusia Today, or if there is a topic you would like to hear featured, please contact Volusia County Community Information at